I'm going to perform the 4 physical examination technique. First is inspection. Involves using the senses of vision, smell, and hearing to observe and detect any normal or abnormal findings. This technique is used from the moment that you meet the client and continues throughout the examination. Next is the palpation. Palpation consists of using parts of the hand to touch and feel. The 4 techniques of palpation are light palpation. There should be very little or no depression, less than 1 centimeter. Next is moderate palpation. Depress the skin surface 1 to 2 centimeter. Next is deep palpation. This should result in a surface depression between 2.5 and 5 centimeter. And the last is bimanual palpation. Use 2 hands, placing one on each side of the body part, being palpated. Then the third technique is percussion. Involves tapping body parts to produce sound waves. The 3 technique of percussion is direct. Tapping of a body part with one of 2 fingers to elicit possible tenderness. Next is the blunt. Percussion used to detect tenderness over the organs. And the last is indirect. Is the most commonly used method of pressure. And the last technique is auscultation. It's the type of assessment technique that requires to use a stethoscope. So next, we're going to inspect the patient. So first is inspection. First is I will check the vision. Second, I will check the mouth. And next, I will check the smell of his ear. And the last one, I will check his breathing. Can you please inhale and exhale? Inhale. Exhale. Inhale. Exhale. For those 4 part of inspection, their nose is abnormal findings. Next, I will proceed to palpation. First is light palpation. I will check his pulse. There's no abnormal findings. Next is the moderate palpation. I will check his muscle. There's no abnormal findings. And then the next is deep palpation. I will check his abdomen. There is no abnormal findings. And the last is bimanual palpation. I will check his findings. So the next technique is percussion. They have a three types of percussion. First is direct percussion. I will check his bowl. There's no abnormal findings. Next is I will check the blunt percussion. So I will check his liver. There's no abnormal findings. Next, the last technique of percussion is indirect percussion. I'll check his sleeves. There's no abnormal findings. And the last technique of physical assessment is the auscultation. I'm using the stethoscope. So that is the old technique of physical assessment.